المحاضرة القادمة الدكتور إسلام عنان. هو في مقدمة كبيرة قوي يعني عن الدكتور إسلام، إن شاء الله يعني المحاضرة أكيد جميلة زي المقدمة الجميلة. أول سطر بس. طب أنت خضتني طول القعدة وأنا هقول كل المحاضرة دي. Founder and CEO of Axite LLC. LLC بقى اختصار إيه يا دكتور إسلام؟
Limited Liability Company, Axite LLC.
أوكي.
Healthcare consultant.
عنوان المحاضرة Artificial Intelligence Use in Healthcare. اتفضل.
Thank you, Doctor. I would like first to thank the conference committee, Dr. Sahar and Dr. Rania. Thank you for the invitation. Thank you for the panel and my professors attending my lecture. Good morning, everyone. So I will just take an ease from Dr. Neha to complete. So I teach health policy and health economics at Faculty of Pharmacy. I'm a pharmacist by education. And I do as well consulting services to the UNICEF and the Ministry of Health here in Egypt and in Dubai and Saudi concerning health policy and health economics. So I will be tackling maybe a bit integrated subject between healthcare and pathology and diagnostics and the use of digitalization and artificial intelligence. Without further ado, that's my disclaimer on conflict of interests. And actually, we are witnessing maybe 10 years or 15 years ago a new era in terms of healthcare. This new era started from 1955, since we identified that there is something called artificial intelligence, and we can actually use the artificial intelligence in terms of industrial medicine, in terms of pharmaceuticals, and in terms of healthcare diagnosis as well. From the 60s and 70s, we started to identify bacteria and doing AMR programs using digitization and artificial intelligence, but it was very limited in scale. Then in the 80s and 90s, we started to use artificial intelligence in data generation and data informatics, and that was actually huge applications in healthcare, and that's my domain of specialty. And from 2010 to 19, we started implementing artificial intelligence in health records, in electronic medical records. Currently, since 2019 onwards, we are using artificial intelligence, and I'm talking worldwide, of course not in the Middle East, in R&D. In R&D, we select successful molecules proactively through artificial intelligence. In preclinical setting, using the right medication with the right animal, we are using it with artificial intelligence. Currently, not all clinical trials and all preclinical trials are done on animals. Sometimes you do it on a simulation basis before testing on animals. In personalized healthcare, which is the future of healthcare. In 5 to 10 years, all of us will be using personalized healthcare. No two individuals will be taking the same dose or the same medication anymore. And finally, the revolution led us to make what we call a health information system, what we'll be actually discussing. If artificial intelligence in 2021 investment, it was actually around $7 billion US, we are expecting in 2027, the artificial intelligence to be around 67.5 billion in terms of revenues generated. So we are talking about something which will not take our human places. It will not going to take our work and positions. However, it will be the new tools we are using. So the main thing about AI, it's not about taking decisions. It's about helping us taking better decisions. So it helped from the limit of digitization only. And by digitization as a terminology or a jargon, it means just making the healthcare paperless. Just writing any paper inside the healthcare system on a digital platform. That's digitization. Till the complete digitalization, which is having a system that we can actually work like the Microsoft systems for healthcare and Oracle and so on. So it started with what we call managing data as a strategic asset. So how we can actually categorize data, how we can actually put data into cohorts, and instead of, and I will tell you a story, I'm a researcher, basically I'm a researcher, we work with data, big data. We spend sometimes weeks just to make data cleaning, just to take electronic medical records and make data cleaning. My mother was a researcher as well, and she's telling me before computers, she spent almost 8 to 9 months just taking data on paper and trying to clean it herself, trying to implement statistical considerations. And currently, we are doing it back office in 1 day. I just put the codes for the data cleaning code and the protocol, and it's just gonna be cleaned in around 1 hour. I just need to check that the code is correct and the data is already cleaned. Then, empower the data-driven decisions, making sure that if I'm taking a decision, and we know that most of us are haphazardly actually impacted by a lot of decisions in our workplace, in our governments, in our healthcare settings, that it's not empowered by data. The use of AI is to empower these decisions with data, connect the care teams. Currently, we are witnessing the telemedicine, for example. In Egypt, we do have 15 telemedicine sites where patients can actually remotely, using Skype, communicate with their tertiary care and taking their medications. And finally, build a learning health system. By learning, it's what we call a machine learning. So every year, we are witnessing a new era of having better diagnosis and better treatment algorithm using AI. So instead of using the usual pyramid when we are using in clinical trial, that's what we are using in clinical trials. The data, we move to information. If we do have the right knowledge, we implement it, and we do have what we call the clinical research wisdom. In AI, we're doing it the opposite way. I give the codes to the AI as a wisdom. I tell them, okay, my decision should be on a hypothesis of 1, 2, 3, and 4. And they dig actually into data and information and trying to support or reject my hypothesis. So, for example, in Canada, they are using the Knowledge Development System, KDS, where they are not allowed, the Minister of Health in Canada is not allowed to take any decision unless he got data and he submit the source documents of data, transform it to information, got the knowledge, write the wise policy abstract, and finally take a decision. Otherwise, the decision will not going to be taken. And hence, we do have something like Lorenzo in England, which is the HIS system in NHS, which is completely paperless, where patients can actually just start with a kiosk in the system, and everything will be linked through AI and digitalization from, for example, scheduling a visit with a consultant, taking the medications, lab tests, even meeting with the tertiary care, ongoing care and monitoring, and finally having all the reports in one place. And that's what Egypt is trying to do in the new healthcare system, by the way, trying to adopt something like Lorenzo, but still in trial phase. So if we're talking about applications of AI in healthcare, we are talking about improved healthcare access through chatbots and through that the AI is communicating with patients. No longer there is no call center, there is no employee who can actually just dispatching patients over healthcare. The AI can actually dispatch patients based on the available, for example, ICU beds. If you'd like to distribute the patients on ICU beds, he can do it himself. In the virtual health assistants, like what we were just saying about telemedicine, in clinical trial participation. So currently, when we are doing a phase 1, for example, they can just apply to the AI platform, and the AI will just select the healthy individuals who will be actually eligible and will yield the better results in terms of clinical trials. In fraud detection for clinical trials, and in private insurance company, we make fraud detection AI where they can find similarity in claims, for example, if I'm a private insurance company. In cancer diagnosis, currently it's 50% AI worldwide. In rare disease management, in automation, reduced dosage error, in robot-assisted surgery, of course, and finally, the most important in my domain is the management of medical records. Analyzing medical records without having the normal research methodologies. As a case study, just to give you some applications, in UK, they've done a triage experiment using AI. So the main objective is they are trying to see whether in terms of mega accidents and crisis, can AI do the triage rather than the triage doctor in the ER or not. So they made a simulation program. They took 10 years back, and it was published actually in 2018. And they started to assess whether AI can do the triage himself or not. So they started with a retrospective charts from an ER of hospitals in UK, about 460,000 UK patients administered and actually admitted to the ER, and they gave it to the AI system. And they found that the AI system made a right triage. The survival was around 398,000 cases, and 16,000 died. In reality, 17,000 died. So using AI yielded a better results than human triage used in hospitals. So maybe in 5 or 6 years, the triage will be done through artificial intelligence. We make a huge input using big data of all the previous triage in all hospitals in England, and currently they can do the triage themselves. Another one for artificial intelligence and health informatics, where we are actually using artificial intelligence to put all the medical records in the input machine and have our decisions and our actually medication algorithm as well as an output. Another interesting one as well is the social media listening. And this one is actually, I've used it myself and it's actually very interesting. If you'd like to see a pattern of our medications in Egypt, for example, and you would like to see whether a medication is yielding a social talk regarding adverse events or something, the normal thing is to do pharmacovigilance, a safety reporting, right? But usually in Egypt, the minimum safety reporting, since we are 100 million population, should be around 50 million adverse report every year. But we are generating 3,000, that's it. So artificial intelligence, you can just write down, for example, and this is a live example. I've wrote here Accutane. You know Accutane for acne? So I would like just to know whether on social media people are talking about acne or not. And I asked artificial intelligence to get me all adverse events for Accutane and only from Twitter. So I got, for example, you will never understand dry lips until Accutane. I hope it's normal that I have been on Accutane for almost a month and I have seen absolutely no change. What's going on ever since I stopped taking clopidogrel and Vabrid, I have recurring feeling of shock impulses. So you will get every single word on social media in a click of a button regarding a certain medication. Imagine how many medication we can actually get out of the market or identify adverse events or boost for risk management plan. The risk management plan is what we are doing for any medications got adverse event not inserted in the label itself. So the main question is, are we ready in Egypt for artificial intelligence? This is a tricky part. So countries applying AI policy. So currently we do have countries applied AI policy, whether for healthcare or not. But if you can see, because of the digital screen, you cannot see it clearly, but we don't have in Egypt a digital or AI policy strategy yet. So that's actually what we need first. And because we do have a lot of entities, we do have the Ministry of Health, the EDA, the UBE, UHIA, EHA, GAHAR, a lot of entities. And you cannot just let any entity work alone using AI. And you can add the research partners, and you can add the governmental hospitals. You can add that we do have what we call presidential initiative, huge entities, and you got the whole system. You got all the university hospitals. You got El Amana, which is a trust for the medical specialized centers. And without integrating all these units together, AI won't work. And our usual advice, and what we communicated with the Egyptian government as well, if you'd like to apply even digitization, not artificial intelligence, you need to take a stepwise approach. From stepwise approach, you can see it's 5 stages till you reach a good digitization, then you can apply AI. And you can see that countries are not shamed to identify their stages. So the first stage is you're still using conventional paper-based systems, but you do have health indicators. So you are talking about Kenya, Mozambique, for example, and currently Mozambique and Kenya are in stage 2. Stage 2, optimizing the paperwork, and you can see Ghana, India, Indonesia. Stage 3, which is the migration phase, you can see that Rwanda and Mexico, they are in stage 3. And I'm not, by the way, in this chart, I didn't take European countries or so, I just took the African countries, the neighboring countries. And in stage 4, trying to introduce IT system in terms of having good digitization, like China, like South Africa, like Uganda. So Uganda is in stage 4 currently. Then stage 5, having artificial intelligence and digitization. So I cannot jump from which stage we are currently in Egypt. Do we have health indicators, paperwork health indicators? So even we need to finish the 5 stages, but we cannot jump from stage 0 or 1 to stage 5 one time. There is no leaps. I need to identify a good roadmap if I would like to use artificial intelligence. There's a lot of questionnaires to help countries to do that, starting from managing data, whether I do have an integrated clinical trial that can use it or not. And we are facing currently mega problem with approving clinical trials. Most of the files we are submitting for phase 3 clinical trials are rejected. We need good patient access. We need cybersecurity laws. We need clinical decision support, for example, remote digital caregiver support, and free up time for caregivers. All of these check boxes, we need to make sure that's already there before implementing. So to implement, you need resources. You need a lot of human resources, educated. You need a lot of money to implement. We are talking about, for example, around 100 million US dollars just to implement the infrastructure necessary to link all the citizens and all the governorate together. You need, of course, IT infrastructure, and you need legislations for the process flow. You need a good roadmap, and you need health indicators and informatics so you can track your success. So finally, no data, no artificial intelligence, no healthcare, and no reform. I also would like to refer to the point of diagnosis. That's one of the most important topics currently in Egypt, and where we can use artificial intelligence, and we started to implement better diagnosis because, thank you, Dr. Dario was talking about MS. We've done a study for MS, and we found that in 2010, patients of MS were actually suffering from 5 to 7 years before getting diagnosed. Currently, we got better diagnosis. However, patients should actually go from 2 to 3 neurologists or physicians to be diagnosed as MS. All neurological disorders currently in UK are putting their files in artificial intelligence diagnostic tools, and they are getting marvelous results, Just put all MRIs, all CT, all lab tests in the AI machine, and they can predict whether the patient got high probability of being a multiple sclerosis patient or not. AI in healthcare can boost patient treatment journey optimization. That's our main objective. It's not the objective. AI is just a tool. We can properly use it, or we can use it in the wrong way. We should use it very cautiously, because AI is input equals output. If you do have wrong input, still you do have a wrong output. Thank you. It was really a pleasure having you. Thank you.
Thank you very much, Dr. Islam, for this up-to-date knowledge. And I think it is now coming over for every one of us to have some knowledge about AI and about other things, which may make us useless after that. It works for, instead of us, the AI.
It will never replace us.
It will never? Okay, thank you. If anyone wants a question, حد عايز أسئلة يا جماعة اتفضلوا. No questions? Okay, thank you very much. I have the opportunity to thank Professor Dr. Sahar and the organizing committee for this very good presentations, and thank you. Thank you. We close the session.
بس كل السبيكرز مع الشير بيرسون ناخد صورة جماعية. السبيكرز والشير بيرسون الجلسة ناخد صورة جماعية مع بعض إن شاء الله.